The consumption of alcohol occurs when an individual is stressed and cannot cope with the failures that occurs in their life. Alcohol use disorder is one of the most common psychological disorder, with only 10% of individuals in America using some form of treatment. High consumption of alcohol leads to alcohol use disorder, cardiovascular problems, cancer, and many more health issues. To reduce alcohol use, individuals can ask for social support and also complete an alcohol rehabilitation program. According to APA, the symptoms of alcohol use disorder include wanting to drink so badly that you can't think of anything else, being found drinking or drinking, being sick from drinking, which interferes taking care of your home or family, has caused job troubles or school problems, as well as being in situations where drinking has increased your chances of getting hurt. For example, driving, swimming, walking in dangerous areas, or having unsafe sex, and as well as continuous drinking, which makes you feel feelings of depression or anxiety, as well as having memory blackouts too, and drinking more often to get the desired effect that you want, and also finding out that the effects of alcohol were wearing off. You may have had withdrawal symptoms such as trouble sleeping, shakiness, restlessness, nausea, sweating, a racing heart, or seizures. The presence of at least two of these symptoms indicate alcohol use disorder, AUD. The presence of 2 to 3 symptoms indicate mild, and a moderate is the presence of 4 to 5 symptoms, and severe is the presence of 6 or more symptoms. 12 Steps with Cognitive Behavioral Therapy. 12-step program is used to support those with problems with alcohol, and the most common form is Alcohol Anonymous, AA. And it is a self-help group that encourages those in recovery to meet with a peer, the sponsor. CBT encourages interpersonal interaction and prosocial behavior in order to foster positive self-schemas. For example, the meetings of AAA are intended to foster positive social peer engagement and social support for the recovering individual. As you can see in the picture next on the same slide, the 12-step program, it's a recovery road for many people, but every participant's journey through the program is adapted differently, and it can include a religious or spiritual element. And the recovery journey is completed with challenges, successes, and step back which is different for each individual. Health psychologists specialize in the process of changing lifelong habits through thinking and behavior. For example, cognitive interventions for CBT include recording daily thoughts of negative emotions, pros and cons, imagining a healthy/productive life, and learning problem-solving skills. Whereas in the 12 steps for cognitive intervention, it includes the fourth step, identifying automatic thoughts and attempting to identify the core beliefs to which they are related, identifying where your thoughts and your beliefs come from. And also the 10th step, daily admittance of selfish, dishonest, self-seeking, or fearful thoughts or behavior, writing the list of harms that drinking has caused, and taking responsibility for problems, and as well as prayer and meditation. Behavioral interventions with CBT include identifying triggers, social support, behavioral activation of pro-social behavior, and relaxation techniques and trainings. And in the 12 steps for behavioral intervention, it includes avoiding people, places, things, calling a sponsor or a member of a support group, working with others, being of maximum service to people, and engaging in altruistic behavior. Treatment-related barriers are aspects of treatments such as cost or the treatment system, which can be the unavailability or difficulty accessing the treatment systems, which can hinder treatment seeking. This is the model of the steps of the treatment seeking process. The drinking problem develops. Step 1. Problem recognition. An alternative to this is denial of the problem. Step 2. Decisions that the change is needed. An alternative to this is minimization of the problem severity and also rationalization. Step 3. Decisions that professional help is needed. An alternative to this is self-change, non-professional help, resolving problems without professional help. And then step 4, seek professional help. Make sure that the client is keeping up to appointments. But an alternative to this and possible barriers that occurs are delayed or avoid treatment, ongoing self-changing efforts,